The diagnostic algorithm here is symptom-based, and the aim is to show the anatomical pathway why we use symptoms. So prolapses and symptoms are caused by loose or damaged ligaments, and these fall naturally into three zones: pubourethral external ligament from meatus to bladder neck, middle ligaments, ATFP and cardinal, from bladder neck to the anterior part of the cervix, posterior zone, uterosacral ligaments, and perineal body from here to here. Each zone has specific symptoms caused by damaged ligaments in that zone. Anterior zone, stress incontinence, PUL laxity. Middle zone, cardinal ligament laxity, can cause cystocele. Two main symptoms: abnormal emptying, frequency and urgency. The back ligaments, uterosacral, uterine prolapse, has two specific symptoms: pelvic pain and nocturia, but also it can have abnormal emptying, frequency and urgency, fecal incontinence and obstructive defecation. The perineal body, here, it can have obstructive defecation. Pathways to symptom causation require understanding the muscle-ligament interactions, muscles, ligaments, in urethral and anal closure. So the bladder here and rectum here are storage containers, and they empty to the outside via two tubes, the urethra and the anus. Four pelvic muscles: pubococcygeus forwards, levator plate backwards, conjoint longitudinal muscle of the anus downwards, and puborectalis muscle contracting forwards. They close the urethra and the anus, and they also open it with selective relaxation of one muscle, and this is shown by broken lines for urethra and broken lines for the anus. Pubococcygeus contracts forwards against the pubourethral ligament to close the urethra from behind. If the pubourethral ligament is loose, then the muscle cannot properly close and you may get stress incontinence. The back muscles, LP and LMA, stretch the rectum back and down around a contracted puborectalis muscle to close the anorectal angle. When the puborectalis muscle relaxes, these muscles pull open the back wall of the rectum prior to defecation. So because they contract against the uterosacral ligament for both opening and closure, if the uterosacral ligaments are loose, you can get fecal incontinence and also obstructive defecation. These three opposite muscles, forwards, backwards, downward, stretch the bladder base and the rectum to support stretch receptors, which are called N here and the here as well. And what they do, they prevent afferent impulses going to the brain to activate the micturition and defecation reflexes, and in this way they control urge incontinence of the bladder and the bowel. So if you've got lax ligaments here or here, the contractile force of these muscles weakens and they cannot stretch the tissues to support these stretch receptors, and you can get urge incontinence of bladder and bowel together. Finally, we have the visceral nerve plexuses here, which can cause pain. They are mechanically supported by strong uterosacral ligaments. If these uterosacral ligaments are loose, then the visceral nerve plexus junctions can fire off de novo impulses to the cortex, and these are interpreted as pelvic pain coming from end organs such as the bladder, the bowel, the coccyx, the lower abdomen. The anatomical pathways from damaged ligaments to symptom-based diagnostic algorithm. Here is the birth canal in blue. The circles represent the head as it comes down from the top of the birth canal to the outlet, and the shadings indicate the levels at which the birth canal can be injured. At the top of the birth canal, the head can stretch the uterosacral ligaments to cause uterine prolapse. Further down, it can stretch the cardinal ligaments to cause cystocele. Further down, it can go posteriorly to damage the perineal body and cause rectocele, and if it pushes anteriorly, it can damage the pubourethral ligament to cause stress incontinence. So the circle numbers here, here, correlate damage to the ligaments in red with prolapses here, uterine, cystocele, rectocele, stress incontinence, and symptoms in the 3 zones of the vagina. Here are the symptoms. Pelvic symptoms, all of these, are cortical perceptions of the inability of pelvic muscles to do 3 things: to close the emptying tubes here, to open them, or to stretch the organs to control the emptying reflexes, which is what urge incontinence of the bladder and bowel are. So, to close the emptying tubes. For the bladder, stress incontinence. For the bowel, for the anus, fecal incontinence. To open them, if you can't open them, then the bladder and the bowel have to push against a narrow outlet, so you get symptoms of abnormal emptying of the bladder and obstructive defecation, abnormal emptying in the anus. Here. The third, stretching the organs to control the emptying reflexes. If you can't support the stretch receptors, which are here at the bladder base, or here in the rectum, just above the muscles, then the afferent impulses from the pressure of the bladder, of the urine or the feces, can cause urge incontinence of the bladder and the bowel.